Hi everybody, it's Ruth Health here, homeopathic doctor and integrative health consultant, and I'm here to help you if you're struggling with fatigue, burnout or overwhelm. Today I'm going to chat a little bit about infections. I'm sure a lot of you have never felt well or never really got your energy back since an infection. Sometimes some of my patients come to me and they had an infection even when they were kids, and they swear they've never felt well since then. Um, Chronic fatigue is something that is so difficult to get diagnosed by your doctor. It's something that is so difficult to treat as well because we really don't know where to start. And there's often no answers. There's no simple answers like there is for so many other health conditions. But if you do have chronic fatigue, do start by just checking out if you have an infection that is going on at the moment, or if you have had a very serious infection long ago and you've never been well since. At the moment, there's a post-COVID-19, which there's a lot of fatigue involved with that. But today I'm going to talk about a different type of fatigue because when I talk about chronic fatigue, ME, myalgic encephalomyelitis, chronic fatigue syndrome, I'm talking about a fatigue that has gone on for years and years. And COVID, luckily it hasn't been around that long yet to fall into that category. It probably will be in the future. But for those of you with ME, CFS, or just undiagnosed, ongoing exhaustion, like deep exhaustion, you should always start by looking, firstly, if you have a current infection. So what kind of things should you ask your doctor? I always recommend to people that they do a stool test to see if there's any gut infections going on. Especially, I recommend this if you have a history of traveling to different countries, of actually getting really bad gastro, so if you went traveling once and you got really bad tummy bug, a lot of vomiting, a lot of diarrhea, maybe you've never been well since then. So if that's you, then ask your GP to do stool tests for you. And always tell your GP what countries you've traveled to, because I studied to be a homeopathic doctor in South Africa, and in South Africa we have a lot of infections that you're not going to find in the UK, for example. I'm Zimbabwean, so bilharzia. Bilharzia is very common in Zimbabwe and South Africa. It's very unusual in the UK. So most doctors who are trained in the UK aren't going to check you for bilharzia unless you tell them that you've been to Zimbabwe or South Africa, for example. If you have traveled to South America, you may have picked up something that's more localized to South America and won't be found. For example, now I live in Australia, it won't be found in Australia. But if you just tell your GP where you've been, then they will know what sort of more unusual infections they should look for and what tests they should run. So that's gastro. Think of a stool test. Stool tests can tell you a lot. You can get your microbiome mapped to actually tell you if it's maybe you don't have a gut infection, maybe you have a dysbiosis, you have an overgrowth of the wrong type of bacteria in your gut. This can often be related back to an original infection or to the way you eat. Just by what you're looking for here is a starting place to start moving forwards from. If you know what infection you have, if you have a current infection, then you'll know how to treat it. So that's your gut infections. Blood tests, always get blood tests done. When you go to your GP, they usually test to check if you're anemic or if you've got a thyroid disorder, if you are really tired. But you can ask them to also just run some tests for certain infections. Okay, the most common infections for chronic fatigue are your glandular fever or infectious mononucleosis. So that's Epstein-Barr virus, cytomegalovirus as well. Herpes virus can often lead to chronic fatigue. Ross River virus as well. Then you've got Lyme disease, your Borrelia, and that's actually a bacteria, but that is associated with years and years and years of severe fatigue. And Q fever as well. And then, of course, there's fungal infections. So your most common fungal infection that causes fatigue is Candida. These are all things that can be checked by your GP through blood tests, through stool tests, just to find out what's going on in your body. You can then be treated. Your GP can perhaps treat you if you've got a bacterial infection. He can treat you with antibiotics, perhaps with antivirals. If your GP can't treat you, then you could chat to a herbalist. Don't try and treat yourself. Go to a properly trained, qualified herbalist, properly trained, qualified homeopath, and get treated properly for your infection. It will make a huge difference to your fatigue levels. If you have something like glandular fever when you were 18, 19, and you're now in your 40s and you're still struggling with fatigue, then I personally recommend homeopathy because I'm a homeopath and that's what I use with my clients. But there's also a lot of herbs that can help as well. So find a therapist who you know, who you like and who you trust and who's properly qualified. I like to underline that because unfortunately people can practice without proper qualifications in a lot of countries. So find someone who's registered. And they can help you a lot. Don't try and treat a past infection or current infection by yourself. Go to a doctor, go to a homeopath, go to a herbalist, phytotherapist, and get somebody to help you. It can really make a huge difference to your fatigue. Alrighty, that was just a quick chat today about where to start when you are struggling with ongoing fatigue. Some ideas to look at, some common causes of fatigue in terms of infections. And if you have any questions, please put them in the comments below. And in the description below as well is a little free checklist you can download and take to your doctor with ideas of possible causes for your fatigue. So infections is listed there, but there's also things like maybe it's your thyroid, maybe it's anemia. Those are all in the list. And I've actually just thought of something. You see my brain fog. Another common infection that we tend to forget about a lot, I mean, I forgot about it right now, is a dental infection. So if go to your dentist regularly, have checkups, because often what can happen is you can have a gum infection, a deep-seated dental infection that has no signs or symptoms. And that is causing you a lot of fatigue. I was actually speaking to a friend of mine the other week, and she said that she had a deep-seated gum infection and she didn't even know she had it. She felt nothing. So that is also a big contributor to fatigue and something else you need to get checked out. Alrighty, take care and I will see you next week. Please ask me any questions. Don't forget that I do a Facebook Live every Monday afternoon, 4 p.m. Australian Western Standard Time. So send me questions if you like, or hop on and say hello to me. Take care.